see you here. Thank you for watching. I'm working in a laboratory in Guangdong Provincial People's Hospital, where I found a really interesting case that I want to share with you. The whole case will be demonstrated into 4 parts. Now let's get the ball rolling. Neosartorya hiratsukae, polymorph of the Aspergillus section fumigati, is a rare fungus isolated for the first time in Japan from indoor air and from pasteurized aloe juice. Neosartorya hiratsukae is often misidentified because it cannot be distinguished from Aspergillus fumigators by conventional methods. Nowadays, we could identify it at molecular level, such as employing different primers in multiplex PCR or different electrophoretic profiles, and so on. But whatever we use is all about the specific nucleotide positions of each species. Neosartorya hiratsukae is an opportunistic pathogen, and only few cases of human infections have been reported worldwide, such as allergic fungal rhinosinusitis, cerebral aspergillosis, and peritonitis. And now, back to my case. It was the first case found in China to our best knowledge, and thanks to close cooperation with the clinical, the patients were discharged. We are highly calling for robust methods for identification. Alright, now a patient was admitted to our hospital due to unbearable abdominal pain. His CT scan indicated peritonitis. The patient's blood and peritoneal fluid were cultured, but all results showed negative. Since we didn't find out the responsible pathogen, antibacterial treatment was arranged imperatively. Unfortunately, the patient showed bad response to it. Something must be missed out. Then we check out everything from the beginning. Surprisingly, we found out fungal wells in a culture bottle, and then they were subcultured and under examination. But we only could tell it was aspergillogenic filamentous fungi. Even the multi-TOF mice failed to identify the species. Therefore, standard sequencing was used, and then it was finally identified. The morphological examination was completed after 10 days incubation because filamentous fungi are slow-growing, and all the features were consistent with what we found. Then the patient was treated properly and was discharged from hospital. Well, actually, the whole identification process was slower than the ideal, which was mainly because microscopic examination showed negative. The flocule precipitate might clog the needle, making it difficult to catch target fungus. And the poor fixation also could cause underreported. These scenarios could be avoided by mixing the bottles completely, performing microscopic examination under low power, or exchanging to a larger syringe. Blood culture well showed false negative. It has been widely known that the metabolism of filamentous fungi is slower than that of bacteria. Thus, the growth curve is flat, which is not enough to trigger a positive rule. Therefore, it's better to carefully observe whether there is precipitate clots in culture bottles during subculture or before discarding. Traditional methods appear to be flawed, especially when facing the new fungal species, which are morphologically similar to Aspergillus fumigators. Since it still accounts for more than 90% of all invasive aspergillosis cases, so developing a rapid, accurate molecular identification method is urgent. However, there were limitations in this case. We didn't perform antifungal susceptibility testing. In fact, since a variable response to antifungal drugs between species, these tests should be investigated and recorded for therapeutic efficacy. The infection was under well controlled, where the treatment regimen was switched from antibacterial to antifungal properly. Moreover, we offered all laboratory results to monitor and evaluate the treatment. We believe close cooperation with the clinical is the first step for serving our patients. Okay, that's the whole story of this case report. We do think our case was of great importance. It was the first case reported in China, supplementing the geographical distribution information. This case highlighted the importance of cooperation with the clinical, which helped reduce underreported cases and mortality. Last but not least, as a laboratory person, we are highly calling for rapid, accurate, and economic methods for identifying the emerging rare fungus. Okay, thank you for your attention, and you are welcome to visit us. Thank you.